The first face transplant. The history of plastic surgery is full of inspiring examples that help many people believe in miracles and change their lives. Science was born in ancient times, but as a full-fledged branch of medicine, it was developed at the beginning of the 20th century. During the First World War, the officer of the battleship Walter Yen was terribly wounded in the fierce Battle of Jutland, which disfigured his face. His entire upper body and eyelids were burned off, so he couldn't blink. A large queue of mutilated military personnel in the hospital delayed the treatment time, and the officer's condition gradually deteriorated. But after many months of waiting, the famous London surgeon Harold Gillis became interested in him. The doctor believed that he could help Walter. In 1917, he developed his own technique, which involved the transplantation of skin grafts from healthy areas of the body to those requiring restoration in order to fuse them. By that time, due to injury and metabolic disorders, scars from amyloid tissue had already formed on the officer's face. This created an additional problem. It was necessary to completely remove the scar tissue to form a new one. Under anesthesia, the surgeon completely cut off the scar tissue from a large area of the patient's face. Using his method, he formed a mask from a flap of healthy connective tissue and transplanted it onto his face. He made incisions for the eyes, so Walter got new eyelids and the ability to blink normally. The operation lasted several weeks and was performed in several stages. But the process of tissue fusion did not go so smoothly. Walter was diagnosed with an infection. We must pay tribute to the endurance of the officer who decided on this adventure, and the courage of the doctor, who managed to successfully complete the process by removing the infection. The surgeon's technique worked, and the new skin took root on his patient. After that, there was a long recovery process. The officer's physical condition gradually improved, and he was invited to serve in the Royal Navy, where he continued his career. And Dr. Harold Gillis saved many more lives and performed more than 10,000 operations on 5,000 military personnel during World War I using his revolutionary method. Harold Gillis is considered the father of plastic surgery, and this operation went down in medical history as the first face transplant. Based on the experience of past achievements, today, modern technologies and the latest techniques in plastic surgery allow you to work wonders by performing transplantation operations of varying complexity. This helps people who have suffered complex bodily injuries to return to normal life. A face transplant is a treatment option for some people with severe facial injuries. A face transplant operation can replace all or part of a person's face with their own or donated tissue. A face transplant is a complex operation that takes months of planning and several surgeries. It can improve the quality of life, but it carries high health risks. The transplant specialist will not be able to predict how the patient will look after surgery and how the immune system will react to the new face. The patient should be prepared to take special medications, immunosuppressants, for the rest of his life in order to reduce the risk that the body will reject the transplanted skin or other facial tissues. When a face transplant is performed, a face transplant is performed to try to improve the quality of life of a person severely disfigured by facial trauma, burns, diseases, or birth defects. It is designed to improve both appearance and functional abilities, such as chewing, swallowing, talking, and breathing through the nose. Some patients are considering this surgery to reduce social isolation due to severe deformity. Risks and complications. A face transplant is a complex operation with a risk of complications. Complications may occur as a result of body rejection surgery for tissue transplantation, side effects of immunosuppressants. A face transplant is a long-term procedure that can take 10 or more hours. Surgical and post-operative risks can be life-threatening. These include blood loss, thrombosis, and infections. The body's immune system may reject donated tissues, as a result of which the patient may lose part or all of the new face or some function of facial tissues and nerves. In order to control the reaction to rejection of donor tissues, the patient may need to undergo treatment with an intensive dose of IV anti-repellent drugs. In rare cases, tissue rejection requires a new transplant. Anti-rejection drugs, immunosuppressants, weaken the immune system. This helps to prevent tissue rejection, but also puts the patient at risk of various infections. Immunosuppressants are also associated with an increased risk of kidney damage, cancer, and diabetes. Contraindications to the history of chronic nervous diseases, pregnancy diabetes, heart disease or cancer infections, smoking alcohol or drug abuse. Preparation for face transplant surgery. Before the operation, the patient will have to undergo a full and comprehensive examination: blood test, urine test, ECG, ultrasound of the heart, ultrasound of the soft tissues of the face, chest CT scan, MRI of soft tissues, assessment of mental and emotional health. Upon receiving a referral for a face transplant, the patient will be added to the donor waiting list. When selecting a donor, it is taken into account blood type, tissue type, skin color, comparable age of the donor and recipient, the compatible face size of the donor and recipient. How to do a face transplant. The degree and duration of facial transplantation surgery depends on which part of the face and its main structures are involved. A transplant surgeon can transplant various donor tissues such as skin, fat, muscles, tendons, cartilage, bones, nerves, and blood vessels. Surgery can take from 10 to 30 hours. After surgery, the patient is likely to spend 4 weeks in the hospital. The daily post-operative routine will include taking immunosuppressants and reducing side effects. Results. The transplantologist cannot know exactly what the results of the operation will be, since each face transplant is unique, and the patient has different experience with post-operative appearance and function. Most patients have improved their ability to smell, eat, drink, talk, and smile. Some patients regain the ability to feel a light touch on their face. 3D technology is an important part of face transplant operations. Complex surgery requires not only a qualified medical team, but also technologies that ensure effective planning and safe execution of the operation. In this operation, such technologies were introduced by the PlanMecca Pro Model Trademark Service, which offers customized 3D planning and patient implants for surgical manipulation. PlanMecca's technologies and expert level of services have significantly reduced the operating time and improved the accuracy of the operation, as a result of which the operation has become safer for the patient. Advanced 3D technologies combined with extensive experience and know-how are the basis of our service. This, the second face transplant operation in Scandinavia, was modeled and planned using our 3D technologies. For the operation itself, we have developed and 3D printed surgical templates exactly according to the anatomies of the donor and the patient. These templates saved hours of work and ensured its accuracy, said Gianni Horelli, PlanMecca CAD/CAM design manager. PlanMecca has been a reliable partner of HUS Hospital in many complex operations. The collaboration lasts almost 10 years. From the very beginning, PlanMecca participated in the planning of the second facial tissue transplant operation, led by CAD/CAM design manager Gianni Horelli. Surgeons and engineers work closely together to advance the healthcare industry. We worked a lot with PlanMecca during the planning and execution of the first face transplant operation, which was successful. From the very beginning, we understood that we wanted to continue working with PlanMecca also during the second operation, which was even more difficult than the first. Our experience of the first operation has brought certainty for the second for both HUS and PlanMecca. This know-how has made planning and collaboration even more cohesive than before, Dr. Lassus describes. This time we transplanted more tissues than in the previous operation, so the role of technology was key. PlanMecca and their 3D technologies have reduced the operation time by hours and improved the accuracy of the operation compared to traditional methods. Without advanced technologies, operations of this level cannot be performed, concluded Dr. Lassus.